My name is Gina Lathan. I was born and raised here in Springfield, so Springfield is home for me, and definitely I have been a part of the district all of my life, childhood and adult life. I worked for the state of Illinois for 7.5 years. During that time, I had the pleasure and opportunity to be a public service within state government. I started off with around I think an $8 million budget or so, and over time during my tenure within the state, when I left, my budget had exceeded to $70 million, and so I have a clear understanding of how to manage dollars within the state system, understanding the differences with the appropriations for state and federal dollars, and how those partnerships need to look, and what the services and how services should look once they reach the ground. After leaving the state, after my time there, I moved on to pursue my PhD in community health at the University of Illinois Urbana-Champaign. I have completed my coursework in the community health program with a specialization in public policy and program evaluation, and I've completed my examinations. I also had the opportunity to pursue a long-term dream, which was starting my own company. My company, Lathan Harris Incorporated, has had the opportunity to provide an array of services in the area of project management and program evaluation throughout the state of Illinois. We've also done work in other states, and we've also had the opportunity to do some projects on an international level. My life experience are very broad and diverse, and I've had the opportunity to engage in and share life experiences with different people from different walks of life throughout the district. And that understanding, along with my professional and academic training, has given me a good insight in terms of the needs of the 96th district. And that is how I derived at my platform. As a state representative, I think it's very important to have a platform and to have a foundation in which you begin to lead as well as serve. And so your intentions are clear when you're moving throughout the district and when you're working with your constituency and providing representation for them at the legislative level. My platform consists of small business development and expansion, because I understand as a small business owner that small businesses increase the tax base. It provides an opportunity to create more revenue for local and state government, but it also provides an opportunity to create new jobs. It provides structures in communities, a lot of communities which reside within the 96th district that are economically challenged. And so as you look throughout the 96th district, you'll see that we do have some communities that need to be revitalized. And so what a better way than to have small businesses that are anchored by more chain establishments to provide job opportunities and increase the economic base. The second component of my platform is math and science, more emphasis around math and science for not only children but adults. We as a district as well as the state, we need to begin to work together a little closer and begin to provide supportive services and support our varying types of school systems to prepare our children for careers and to be competitive from a global perspective for the 21st century. And so math and science provides those opportunities. What we do know in regard to math and science is that children who excel or who are proficient in math and science are less likely to drop out of high school and more likely to attend and graduate from college. We also know that children who excel and receive supportive services in math and science are less likely to be expelled, are less likely to be suspended, and are less likely to drop out of college. And so when we look at adults who are challenged because they don't have the skill sets to compete for living wage jobs, we know that we can start within our school systems. We can start within our communities working in the area of math and science. In regard to adults, a lot of the Springfield is a leader in the state in the health industry, especially in downstate Illinois. And so healthcare is a trend career path for the future. And a lot of those careers have an emphasis in proficiency in math and science. And so case in point, we do have quite a few individuals who have successfully completed programs such as CNA programs, and they're working and they're very successful in their jobs and they're doing quite well, to the point that they have learned the skill sets of those that may have been certified as LPN or maybe so RN. But unfortunately, a lot of them cannot pass those basic math and science courses. Passing those courses provide more than just a certificate or a degree. It provides an opportunity in pushing someone over the threshold from poverty or low income to prosperity. We have to begin to move forward in preparing adults to provide for their families, because what we do know is, going back to our young people, when our children come from homes that are more financially equipped to prepare for them, to provide for them, then they're more successful, they're more well-rounded, they have a broader worldview, and they're more prepared to be competitive in our workforce. And I think that we really have to become more serious about how we're preparing our children to live, to act, and to become good citizens. The third part of my platform focuses on safe neighborhoods. Safe neighborhoods, violence prevention is very important to me. Violence and crime prevention. But safe neighborhoods are more than just violence and crime prevention. They're neighborhoods that we should be creating that foster the importance and the sanctity of families in protecting our children and giving them the opportunity to live and thrive and grow in a community that cares about them and that they learn to care about their community. At an early age, we have got to begin to prepare our children to be more vested in their community, to be more responsible to their community, to assume more of an ownership of their community. And through those activities and through that type of support, then we will have more responsible adults. Now, is that something that you can legislate? Maybe not necessarily, but a state representative holds a leadership role in the community. So through constituency services, through leadership methods that are very broad but also should be supportive, that should be a priority that the state representative is working towards. And I think I'm going a little hoarse.
Well, speaking of math,
yes.
Let's talk about taxes a little bit.
Yes.
Taxes are going to be a big theme of this campaign.
Mm-hmm.
First of all, where do you stand on extending the state income tax?
Well, what would be my first choice would be to allow it to expire upon the sunset. But I don't know if that's necessarily going to be an option for us as a state. I think that we have a little time. If I'm not mistaken, that occurs at the end of 2014. And so, thank you for the clarification. And so, but even at the end of 2014, it will give us a better opportunity to understand and identify if we have some cost savings. What my hope would be is that we could identify some cost savings, though I don't know if it will be this soon, through savings for the medical impact for initiatives such as the Affordable Care Act. Unfortunately, I don't think that's something that we're going to see savings for this quickly. That particular issue is something that I think that we as a legislator, and based on my experience in understanding budgets and how to identify cost savings, then I would be able to make a more of a informed decision. Off top, my first choice would be to allow it to sunset, but I am not going to commit to that because I think that there needs to be more of a thorough review of the budget.
Do you think it's realistic that they're going to find $3 to $6 billion in savings
in 12 months?
Well, which is what they're going to have to do if the tax expires.
Exactly, and that's my concern. I just don't know if we have those dollars. I would definitely not want those the tax to be permanent, but I do think that we have to be responsible and understand that there are expenditures and bills to pay through the state system, and we have a lot of bills, and we have to pay those bills to move the economy forward, especially when we're talking about small businesses. If they don't receive their reimbursements in a timely manner, then that could be the difference between them being able to open and have their doors open next month.
So would you support another temporary extension of the tax?
No, I'm not saying that. What I am saying is that we have to, what I would do is I would look at all aspects of the budget. In understanding how a budget works, look at all aspects of the budget, identifying where the cost savings are, if those cost savings can sustain themselves to the next state fiscal year, and then making an informed decision.
Okay, you've been a candidate for some months now. Have you looked at the budget or from your knowledge of state government, anywhere that you think could be cut?
At this point in time, I haven't taken a complete look, and done a full analysis of the state budget. No, I have not. But any budget cuts right now offhand, I don't see any. I really don't. Right offhand, I don't have any suggestions. But as I said before, I haven't taken a thorough look at the full budget.
Okay, because then we've got that same problem again with we're going to lose $2 or $3 billion starting 12 months from now. Then the budget that the governor announces, it's actually the next fiscal year starts, in July.
It does.
And that's going to have a $2 or $3 billion gap in it because, if you don't extend.
Well, I'm not saying I'm not going to look at the budget. I'm just saying I haven't looked at the budget at this time, and I do know that to make an informed decision, I need to not only look at the budget, but I need to have a good understanding of how state budgets run and operate, and when you make cuts, what those impacts are and those implications are for other programming or services.
Just on the small business emphasis that you talk about.
Yes.
Big issue right now, could be seen as a political issue. Minimum wage, it's now $8.25 in Illinois. Should it change?
I do believe that there is a need to increase the minimum wage.
Do you want to see it like the governor wants it to $10?
That is something that's fair. I think that we need to, the governor has made a position on the $10. There are some other proposals out there. What I have not seen, and I have made some phone calls and set up some meetings to have more conversations with those who have more knowledge and experience around this matter, is what is the implications of not only just $10, but increasing it systematically over a several year period. Because yes, we're having a conversation that there is possibly a need, and I believe there is a need to increase minimum wage. But I also believe that we need to create more opportunities for living wage jobs. Minimum wage, in my opinion, was not established to maintain a household. And so the issue may not necessarily, there is a need to increase minimum wage, but there's also a need to create jobs that are able to provide for a family and provide opportunity to foster and create, foster and build the skill sets of our workforce. That's the real issue, that we have to begin to create a more competitive workforce within the state of Illinois, because when we create a more competitive workforce, then larger corporations and larger companies that can provide a higher living wage are more attractive to the state. And so while we're looking at minimum wage, we also need to be having more conversations and looking at how do we increase the knowledge and the skill set of the workforce, and how do we attract more businesses to downstate Illinois.
Going back to something you just said, though, about increasing minimum wage, I think you used the term incrementally. Are you saying that it should be tied to the rate of inflation going forward?
No, that's not what I'm saying. But I am saying that some of the proposals that I've heard about are that 1 year it may be a certain dollar amount, but over a several year span it would increase to a certain dollar amount. And I just don't know if we're at the point in the state that we can say wholeheartedly that this is the best plan for the state. I'm not against it, but I do think that we need to begin to explore these issues, and not just explore them in a silo and say, okay, we need to increase minimum wage. Well, yes, we need to increase minimum wage, but we also need to increase the skill set of the workforce. We need to begin to attract more employers that will pay a higher wage than minimum wage. And we need to change the conversation, and we need to change how we are attracting businesses to our state.
Do you have employees?
I have some contract. Well, right now, I really don't have a lot going on because I'm running this race full time. So,
And I'm just, those
yes,
who are against
but
raising the minimum
but
wage
those
say,
that work for me have always made more than minimum
No,
wage.
understood.
And so when the conversation first started, I raised the question, well, what is minimum wage? And I haven't paid anyone less than $10 an hour to do work for me. So, and I'm a small business owner, but I do believe that the minimum wage should be increased.
I wonder, switching gears a little bit to pensions and what you think of the pension reform that was passed. Do you think it's constitutional? Because, the legislature is going to find that out at some point.
Mm-hmm. I think that with that piece of legislation, that I'm leaning toward that it's not constitutional, but I'm also concerned that we are, as a state, putting ourselves in a position where we are reducing employee morale and not working with stakeholders from the very beginning to resolve issues. I worked for the state of Illinois for 7.5 years, as I said, and when I wasn't in the union during the entire time I was there. My normal work hours were, I do believe, 8:30 to 5. If I needed to be at work at 6 o'clock, I showed up at 6 o'clock. If I had to stay till 8 o'clock, I stayed till 8 o'clock. If I needed to be, especially during times where we had to do our large spending plans, if I had to work Saturday and Sunday, I was there with my staff Saturday and Sunday. If I needed to take work home, I was there, and I took work home and I did my work. And on the 10th and the 25th, my check stayed the same. The last 4 years that I was an employee, my budget continued to increase, which meant that my workload continued to increase. But not one time did I receive a raise. But with that increase, not only did I do my job, but I did my job very well, and I made sure that the services were provided. I did that because that's the type of person I am, but because there was an agreement made. There was an agreement that I would do my job and that on the 10th and the 25th, I would receive my paycheck. And so if that were not going to take place, then I should have been a part of that discussion, or I should have had someone who was at the table to negotiate on my behalf and represent me. I didn't see that process take place. And so I will be watching, as well as others, to see what the outcome on that situation will be. But I do think that state employees do work hard, and there have been a lot of compromises that have been made, and that at some point in time there needs to be, well, what I would have liked to have seen was more representation for them at the table during this whole negotiation process.
So could you have supported the plan that Senate President Cullerton came up with, which he said he negotiated with the unions?
That was either they would.
They had a number of options that they could pick from.
Yeah, I read those options. I would have deferred to the representatives of the employees before I would have made a decision. I think those
the union said they were with that one. There was many of them. Because they negotiated them
with him.
President,
And so, and once again, I would say that I would have deferred to them, and we would have been very clear, and then I would have moved forward. But just to say yes or no, I think that those conversations should have and would have taken place between myself
So
and I.
would you have voted against the pension reform that passed?
More than likely, I would have said, I would have voted against that.
So there's another $160 billion over the next 30 years that the state does not have. So if you're possibly not extending the income tax, how are you going to pay for that? Because then you have to pay even more into the pension plan, and the actuaries say that it's going to cost us more to borrow money as a state.
Well, to answer your question, right now, no, I can't do that. But what I will say is that when I had sat down and have those conversations, then those would have been a part of the conversation. When you ask someone to come to the table and have a conversation on a position, you have to give them all the information. In the event that I support your position, then this is what this means. If we're in this as a true partnership, we're in it. Now, eventually, I'm going to have to make a decision that's going to make somebody not happy, and I don't have a problem with that. But what I do think has not happened is that these conversations don't happen up front. what occurs is a vote is passed, and then the conversation, it really doesn't need to take place. The state of Illinois is suffering. That we have a lot of debt. We have a lot of bills that need to be paid. We're in a very difficult fiscal situation. But and so some decisions that are not going to make, that will not make everybody happy, are going to have to be made. Yes, there would have had to been some negotiation with that piece. I don't think it would have been an absolute, we're going to be able to pay everything out. But I do believe, as I said before, that the conversations need to be had, and at least you hear the vast majority of those who are the stakeholders and what their position is.
By the way, are you in the pension plan, or did you need 8 years to get it?
I think I just missed it. So
Just to kind of shift gears again, Illinois now has a concealed carry law,
Mhm.
and it's being implemented by the state police, and 16 hours of training. Are you satisfied that that should stay just the way it is, or would you want any changes in kind of where access to guns is now?
well, I think that individuals who pass the qualifications and are awarded a Ford card and have deemed themselves as a responsible individual and have passed all this exams and certifications to receive a gun should be able to carry a weapon, a concealed weapon. What I would like to have seen, and I think we're at the point in terms of the fines and the fees, is more of those dollars going towards educations about gun education and possibly violence prevention.
Well, there are a number of restrictions in the concealed carry law about where you can carry weapons or not.
Mhm.
There have already been bills introduced to change some of those. Do you think that those restrictions ought to be loosened? Can you support the idea of carrying guns in the places that serve alcohol, or places that are mass transit districts? Both those bills have been introduced.
I don't think that you need to carry a gun in a bar. No. I think that
There's also the question of
I think that
restaurants.
what we do know is that alcohol impairs your judgment. We know this already. And so by allowing someone to walk into a place that sells liquor with a gun just creates problems.
Does that include restaurants that just sell food and liquor?
Possibly. We have enough.
Speaking of substances, the president yesterday said that marijuana is no more dangerous than alcohol. We have a couple of states where it's now legal, Colorado and Washington, I think, for recreational use. In Illinois, it's now legal medicinally. Do you have a position on if Illinois just did the right thing and if it should go further, if it should become legalized here?
I'm a public health professional. I've been a public health professional for over 20 years, and I think that research has demonstrated that there are medical benefits to marijuana. We're at the point where we're just rolling out that phase. We need to have a better, we need to have a clear understanding of what that looks like and how it operates in the state of Illinois before we even begin to have any other conversation about where we're going with this. We're just at the beginning stages, and so I think we need to stay on the step one right now and get an understanding before we move forward.
So you would have supported the bill for medical use of marijuana?
I would have, yes.
By the way, when you said that the budget you oversaw at the state included $70 million, was that all HIV/AIDS program?
Yes, it
Is
was.
that program that large?
That
still?
program was, at that time, before the emergency preparedness funding came in, it was the largest budget program in the state of Illinois. Now, since that time, they've lost a lot of the funding that was in place. Some of those general revenue line items are no longer funded, as well as some of those federal dollars. But it is, it is a very important program. It's been I've worked in the field of HIV for over 20 years. I started doing work in the field of HIV through ministry at church, and so it's something that's very near and dear to my heart.
You are running against not only Sue Scher, but also Mike Madigan, who supports her reelection as a freshman. So why are you better than her, and how do you overcome the Democratic Party of Illinois?
Well, I am there. My opponent and I are two very different candidates, and our campaigns and our methods are very different as well. My opponent does not have a platform. If she does, I'm not aware of it, and I'm not aware that there was a strong platform, if any, during her last run. I think it's very important as a state representative that you have a clear knowledge and understanding of the issues and the needs of the district that you're representing. And unfortunately, through some of her voting, as well as lack of votes or sponsorship of specific bills, there has not been much addressed within the 96th district. That I personally have a high regard for educators. I think they're some of the most valued professionals in our society, and sometimes they're the most underappreciated professionals in our society. What has concerned me is that my opponent has not assumed a true leadership role in terms of legislation around education. Decatur has a high school dropout rate of around 38%. That's alarming. And as an educator, one of which who is from that community, that would have been a priority. And it was well, I think that it's not just one way of attacking it, but it's a multifaceted way of attacking it. It's through constituency services, understanding why are the having a clear understanding of why are young people dropping out of high school. I would say that one reason they're dropping out of high school is because of the lack of skills that they have to compete at that level, and then the other reason that they're having a high school dropout rate is directly impacted by the economy. And because when the economy is suffering, we see that those who work or should be working in the economy, their families struggle as well. And so I would have liked to at least have heard more conversation, seen more action around that. In particular, as I said before, I'm a public health professional. And when the conversation was taking place around the implementation of the Affordable Care Act, I actually went to the Capitol, and I went to Senator Menard's office, and I also went to my opponent's office. The United States government essentially shut down as a result of the Affordable Care Act, which was led and spearheaded by our esteemed Senator Dick Durbin. I could not get any feedback from my state representative. There was no conversation, no return telephone calls, and it was very disturbing. In Springfield as well as Decatur, within the 96th district are the two most economically challenged communities. They have the highest level of health disparities. Those disparities are impacted in they look throughout our community as they are some of the sickest, some of the poorest, and some of the most uninsured individuals. They have the highest uninsured rate on both sides of the district. When given the opportunity to vote in support of the implementation of the Affordable Care Act, that not only would provide health coverage for those who were the neediest and the sickest, but also would bring about millions of dollars over the next 4 years in small business opportunities that could be, some of those dollars could be used and very much needed within the 96th district. My opponent, Representative Scheer, voted against it.
And was that to create the state exchange or?
That was a component of it, yes. That was a component of it, but she voted against that.
It didn't pass?
It did pass. It did pass, but if
expansion of Medicaid?
Yes. Mm-hmm. And she voted against that. So that was very disturbing. And it was something that, in terms of a leader, I would have thought that she would have not only supported it, but rallied in support of it, and also worked with her local business leaders to, through constituency services, prepare them to be more competitive and apply for those funds, so that you're moving some of those funds into the 96th district. those dollars, those business dollars, are very much needed in the 96th district. The services around for insurance for those who are oftentimes the sickest but the least likely to go into health services, the more likely to present themselves in emergency rooms as their primary health care provider. Those services were needed, and our representative did not assume that role in terms of leadership.
And you're saying you called her and she didn't call you back?
Yeah, I went to her office as well.
Which wasn't there, you left a message?
Yes.
Have her call you and she didn't call you back?
I went to her office.
Senator Menard do any better?
He did. We actually had a good conversation.
You have on here education, you want math and science. And again, I think we talked about this when I first discussed your candidacy with you, but are you saying that there should be higher requirements for math and science, or how do you manifest an emphasis on math and science just from the state representatives?
I think that we need to begin to be more innovative and creative around math and science in our communities. Our kids learn differently than what they learned 10 years ago. They operate differently, and they're definitely, even though they're into video games, they're more social, and they're also more hands-on. And so programs such as STEM programs, science, technology, engineering, and math are definitely programs that would be a benefit to our community. One way of funding such programs would be to to work in partnership with our local officials, but understanding that the dollars, the new revenue streams that are generated from the small businesses that are very much needed and have the opportunity to grow and thrive throughout the 96th district would be a great way to partner with our local park districts, to partner with our local school districts, and to implement programs that are very innovative, creative, and teach the basic concepts, but also expand the minds and the thoughts of our young people around math, science, and
So
technology.
you're talking about things beyond school districts?
Yes, I am, and it goes back to creating communities where our kids can learn and work and operate and grow.
Getting back to a budget question, Illinois does something that no family could get away with, is not paying their bills. And we've documented that over time. I have yet to find a leader at the state that thinks this is something that needs to be stopped. How do you feel about that? Can this continue on forever and ever through the budget process, or can the legislature and the governor find a way to pay these bills?
I had the experience firsthand of seeing that happening every day. When I worked within the state of Illinois and I managed my budget, we had hundreds of grantees that did exceptional work throughout the entire state of Illinois. They did exceptional work. They provided very much needed services to the hardest to serve and hardest to reach in the most neediest communities, and then they did work in transforming their lives. But when it was time for them to be reimbursed for their services, sometimes it would be months before they were actually reimbursed. And so I think that we definitely need to make sure that we work to, and it's one thing to say, yes, I'm going to work to make sure the bills are paid, but if the money's not there, then it's very difficult to pay the bills in a timely manner. And so our fiscal crisis is something that is definitely a priority that needs to be explored. But with that exploration process, there needs to be a thorough understanding. It's more than just I'll look at the budget line by line, because you don't read and operate a budget by just looking at it line by line. You have to have a full understanding of how, when you make cuts or you add increases or you move certain dollars in and out of various categories, how do you move them in such a way that you can pay the bills and that are internal, as well as those services that are contracted out. So yes, I would definitely think that that's a priority and something I would like to work towards. But I'm not going to say it very simplistically, like it's something that can be handled overnight by just looking at a budget line by line and saying that now we'll come up with a solution. It's definitely going to be something that has to be a team approach.
Where do you stand on graduated tax versus flat tax?
I like the concept of graduated tax. I think that it makes sense. What concerns me is that what I'm not clear is that there are some missing variables that I'm not familiar with. Where are those thresholds in terms of at what point does the tax increase? Is it based on the number of people in the household and the dollar amount that they make? So, for example, if we're working to improve the 96 district, increasing revenue, creating businesses, expanding businesses, increasing income, and a person is at a lower income level, and they're at a lower income level, but they have the skill sets and the work experience to make a lot more money. And so now they're making a lot more money, and they're making money that that is comparable to their skill set and their work experience. And now they're able to save a little money. Should they be hit with an increased tax because now it's kind of like shooting them in the foot? In theory, I like the concept of the graduated tax, but what I don't know is where are those thresholds where there's the increase, and who falls where. I don't know that. So to be able to say, yes, I support it, and I like the ideal of it, but I don't think I don't know, and maybe I'm missing something. I'd be more than happy to read, if somebody wants to sit down with me or share more information, because I know I've talked to several people about it, and I don't have anything tangible to work from. But I think that we need to be mindful of what that would actually look like in the rollout. Some people say, well, you have to wait until it goes through legislation and the legislators will determine it. Well, if that's the case, then, I mean, like I said, it sounds good in theory.
What should be the threshold? Should it be if you make, 60,000, you pay more than if you make less than that? Or?
I don't know. I'm not going to just state that.
Well,
I mean,
you would be the representative.
I would be, but I think that's something you should make a very informed decision. Just to throw out a number and say, oh, $60,000, that's it. It's not really smart to do something like that. I think that we need to be mindful of not only because we be doing this for the entire state, and the cost of living for Chicago is so much different. For you're not going to just throw numbers at me. Pick it up. But I do think that we need to be mindful that the state is very diverse. And if we're doing this for the state of Illinois, we have to be mindful that the cost of living is a lot higher in Chicago than downstate. And do people who don't have children or choose not to have children have to suffer or pay more taxes? I don't know. I think it's something that we really have to, there's going to have to be some sort of formula. So I'm curious to see what some of those ideas are. And I definitely think it's something that I'd be happy to work on and work with.
I'm going to do 10-minute warning here.
Okay.
Just by the way.
If another social issue, legislatures across the country have been dealing with the issue of abortion.
Mm-hmm.
Illinois just finally implemented parental notification for younger women, I guess 17 and under. Do you have any thoughts on, are you pro-choice, pro-life, and should there be any changes in state law from where we are right now?
I lean toward more pro-choice, but I always say, and I mean this with the most sincerity, that women have abortions for various reasons, and they're very personal and they're very private, and they have abortions for various reasons. I've had the opportunity to coordinate a court diversion program where I've worked with women and girls.
This was in Colorado.
Mm-hmm. We worked with women and girls, and a lot of the women that I worked with were arrested for prostitution, drug possession, and drug paraphernalia. And the walk that they lived and their life history kind of put them where they were in life at that particular point in time. That's not saying that they were not responsible for some of their actions, but I am saying that people are very diverse and they're very complex, and people have life experiences that put them in certain places, and they may necessarily choose to have an abortion, but they have them for their various reasons. Now, you mentioned about the parental consent. The parental consent is the majority of young women, young girls under the age of 18. I do believe it's around 80% who have abortions go with either a parent or a consenting adult to have that procedure done. And so when you think about that 80%, they're already there with a parent. It's a very difficult and a very sensitive situation, an event, a life event for them. And I'm not minimizing it, but I am saying that that 20%, that's there by themselves, they have something going on. That the reason they're there by themselves, they're not engaged with the parent. Some of them are going and they're not telling their parent, and they have great parents and they're just not telling them. But some of these girls, and a lot of these girls, and we're seeing it more and more every day, where we're finding 14, 15, 16, 17-year-old girls in the street fending for themselves every day. And so do we say, no, you cannot get an abortion because you don't have a parent with you or someone signing off for that, when they're maintaining a household or living on the streets by themselves? They're doing everything by themselves. And so that 20%, during this process, I've talked to groups that advocate for them, that represent them, and those that support the parental consent, those who do. But as we have these conversations, we're starting to have more conversations around, what about that 20%? What about that 20% that in the event that it was up to somebody to be with them, for them to have that abortion, and they don't have that person with them, they can't have that abortion?
Well, right now you can go to court, probably with advocates, to get the judicial bypass.
Well,
are you saying they should
some
repeal,
of them.
Are you saying Illinois should repeal the parental consent?
No, I'm not saying that. I'm saying that we still have, as a representative, sometimes it's easier just to represent those that it's easy to represent. But that 20% is a little bit more of a challenge. And I'm not saying I have the answer, but I am saying that we have that 20% that we need to begin as a community to give a little more thought to and have a little more understanding. Do I have the answer? No. Am I going to sit at this table and say I have the answer for everything? No. But what I do have is the knowledge that that group is there.
I don't mean to be horribly naive, but isn't this a much bigger problem in Chicago than it is in Springfield and Decatur, or is this a significant problem in Springfield and Decatur?
No, what I think it is, if you look at per capita, it's probably, the numbers are higher. But this is a national issue. And so, yeah, probably the pure numbers, yeah, they're probably higher in Chicago, but they're still people, and they still live and breathe, and they're in our community. And just because their numbers may not be as high as they are in Chicago doesn't mean that we shouldn't acknowledge them and begin to work to address some of their needs.
Right, but you're not specifically saying what we should do about it.
No, I'm not.
Okay.
There's an effort to take a look at school funding in Illinois,
Mhm.
how money is funneled into schools. Have you studied that issue much, and where do you kind of fall on? Are we doing an adequate job of getting money to the schools that they need? How do we fix it?
The challenge about these types of interviews is that I should have all the answer. The relief is that there are a lot of other people who don't, but at least I'm going to work towards it. How do we fix it? I can't answer that question, but what I will say is that we as a state have to do a better job of prioritizing education. We have to do a better job of prioritizing education funding, and making sure that when we look at dollars, our percentages that hover around 89 to 84% of funding, and we're looking for federal funding to offset some of our expenses. And in some cases, we have schools that just are not doing the best. We have to not only look at funding, but we have to look at how we are supporting our schools that aren't producing in a way that they can. Now, what I will say after that is that I've gone to many of the schools in the district, and in particular, I've gone to schools in the Springfield community and been inside those schools even long before I ever thought about running for office. And what I see is that you have schools that are in a principal office, the principal's office. Their closets are filled with shoes and belts and coats and the basic things that children should have socks before they walk into the school in the morning. And so not only, and so when we're asking for funding, maybe sometimes they need that additional funding because they're doing so much more than just doing education during the day. And we have to be mindful that we're asking our educators to be more than educators nowadays. They're social workers, they're nurses, they're counselors. And yes, they should have a certain level of compassion. But for those children who are not having those situations in their household, it kind of slows down the process in the classroom when you have so many children who are having some problems in the household. And I'm not saying kick them out. I'm not saying that because if nothing works well, we know that they do better when they stay in school. But we have to begin to deal with that child and that child's situation in their home, in their community. And it goes back to kind of drilling down on the issue. Yes, we need to deal with education finance, but we also need to be mindful that when we create programs in our communities, that the communities are working in, those programs are working in partnership with our school system, so that you're kind of giving the teacher, the educators, and the administrators a break so that they can do what we're asking them to do. Their primary responsibility is to teach our young people.
Do you think the current system though shortchanges school districts like Springfield and Decatur the way some lawmakers believe?
I think that Senator Menard proposed a piece of legislation that would assist in supporting some of our school districts financially. As you know, in the city of Springfield, a lot of our large buildings are government buildings. And because the Capitol's here and all of our state agencies are. And so we need to begin to identify, especially for the 96th district, ways to also support the school systems that are not receiving those tax contributions, because a lot of the actual space is occupied by state of Illinois. So the state is not paying the state to have a building through taxes. So we're losing out because we don't have we have the benefit of having the jobs and the opportunities within the city of Springfield, but in regard to District 186, we're losing out because we're not getting those taxes that are generated through those buildings.
It's been hard for that payment in lieu of property taxes bills to get forwarded through the rest of the General Assembly because it's really a Springfield problem.
It's a Springfield
so
issue.
I would convince 117 other House members and Senate members to pass that.
It's a job, but it should be. It should be. It really should be, and I think that would definitely help District 186.
We hit our 45 minutes. So
Okay.
would you like to close out? Is there anything you'd like to just remind us of or
Yes,
say
I would like to remind all the voters and all of you that it's very important that we begin the process of revitalizing our communities, especially for the 96th district. We have communities, some of the older communities in Springfield, in Decatur, that are a part of the 96th district, and there's a great need to revitalize those communities. You have great people who live there, you have hardworking people who live there, and you also have people who have long-standing ties, relationships, and pride in their community. If we begin to build businesses, if we begin to build structures for opportunities, it will increase the tax base. It will provide more opportunities in terms of jobs. It will, if we work it and do the work that's necessary, we will greatly support our school systems and our school districts by working to increase the skills and the knowledge and the grades of our children, and also just creating better communities where our families can work, but also play, enjoy each other, and socialize.